If you're hypermobile and you're curious about lymphatic drainage, here is an easy way to work on that without overloading your system. The first one that I recommend to my patients is biological breathing. If you don't know how that's done, make sure you see the end of this video where we post bendy breathing. This is how the body naturally works on draining your master reservoir of all the lymphatics draining into your body, which is just behind your diaphragm. So through biological breathing, the way babies breathe, we're able to empty the content into our bloodstream and out our body. So the first step is biological breathing. The next thing that I recommend to my patients is really facilitating some of the movements or some of the areas where like your sinuses drain here. So just under the cheekbone is a good idea. Working on, I like kind of doing a little hooking like so around my muscles here. They're called SCM, that you can just go ahead and facilitate that. Just don't push too hard. You can use your fingertips to kind of rub them in a downward direction. You can go just to your clavicle or your collarbone, just under the collarbone towards your chest bone with the padded parts of your fingers. You can just make these circular movements, not just the skin, just go a tiny bit deeper. And when you find a sore spot, stay there and just kind of rub it into a circle, and you do it on both sides. The last thing that I recommend to my patients is to just lay down on the floor, just a simple laying down on the floor and having your legs up. This is also a great time to practice biological breathing, which then assists, it's like emptying all the lymphatics in your legs, and then with your biological breathing, you push, basically you get rid of all that in that master lymphatic reservoir. It's very, very important to work on our lymphatics, because that's one of the ways that we get rid of our toxins in our body. The one thing that I want to bring to your attention is that having the leg up is also helpful for people who have POTS, or they have dysautonomia where there is blood pooling that happens, blood goes down and has a hard time coming back up. So it has multiple benefits, but this lymphatic drainage protocol that I recommend to my patients is what I wanted to share with you. Remember that when it comes to managing hypermobility, we want to manage it from different systems of the body need to be managed, and it's so important to work on your movement as the first step in the right direction. That's what this channel is all about. And as someone who treats joint hypermobility, I always make sure that everything else, even though they're not related to your joints, are being discussed, because unfortunately there are not too many providers that know enough about EDS, HSD, and all the different other kinds of connective tissue disorder. Thank you so much for watching, and until next time, take care.